Hello, today I will show you how to document a standard adult general observation chart, or a SAGO chart. This chart has two sides. The outer side contains an altered calling criteria, where the doctors documented an acceptable range of some vital signs which can be acceptable within a certain time based on their diseases or their phase of treatment. Also, outer side includes how to respond to yellow zone and red zone if you have some vital signs fall into these areas based on policies. Next, we see the inner side. The inner side first page on your left-hand side is where you document respiratory rate, oxygen saturation, blood pressure, heart rate, and level of consciousness, or A.C.V.P.U scale. On the right-hand side is where you document temperature, pain score, and other observations such as blood glucose, bowels, weight, and urinalysis monitoring. For example, we have a patient named Harry Porter, date of birth the 1st of January 1996, address 1 Smith Street, Sydney 2000, admitted to renal ward. Medical record number 1234567. His doctor is Dr. Granger. You checked his respiratory rate. It was 18 representatives per minute, so you document it between 15 to 20, so it will be here. Next, you checked his oxygen saturation. It was 96% on room air, which means he didn't have any oxygen support. You will document between 95% to 100%, which is here. Next, you have his blood pressure was 126/80. So first you put a downward arrow in 126 showing systolic or upper number. Then you put an upward arrow at 80 showing diastolic or lower number. Next, you have his heart rate was 76 beats per minute. So you make a dot at 76, which is here. You could see he was alert and oriented. He spoke in full sentence, knew where he was, told you his full details. So you put a dot on alert right, here. Then for the temperature, you got 37 degrees, so you put a dot at 37. Lastly, you have his pain score. He had a pain scored 1 out of 10, so you put R and M at the box mild, 1 to 3. A for rest and M for movement. For next vital signs monitoring, each time you will document same as you just did. So the health professionals can track how fluctuate his vital signs do.